This is a Beggy Sisa podcast.
Certainly in the bubbles I am in, there is fear, there's panic, there's disbelief. For me, one of the most striking elements is that while we knew there were disagreements and policy debates, the inhumanity, and not just again about HIV and AIDS and PEPFAR, but the inhumanity about people's lives, people's careers, the absolute uncaring way in which these things are being done, that is everywhere.
Welcome to this edition of Beggy Sisa's podcast. I'm Mia Malan. Several HIV treatment clinics in Cape Town, Johannesburg and the Eastern Cape temporarily closed down this week. The clinic staff is funded by the US government's AIDS fund, PEPFAR, and the new Trump administration ordered them to stop operating until his government has decided whether it will continue to fund them. For this to succeed, the programs need to align with Trump's ideologies, which include condemning abortions and not supporting transgender people. Waivers have since been issued for projects handing out life-saving medicines, but the waivers don't contain lists of drugs that qualify, so everyone is confused. Mitchell Warren, the head of the New York-based advocacy organization AVAC, is spending the week in America's capital city, Washington, D.C., attending meetings to make sense of what's going on and what will happen next. Mitchell, thanks as always for joining us. What are the latest developments?
It's a wild and unprecedented time, Mia, I have to tell you. And I was thinking about this, sitting with you in Johannesburg not even 2 months ago, when we talked about what might happen after the election. It is really quite remarkable that although we knew there'd be changes, we knew it might be difficult, I don't think anyone could have predicted the enormity of the last 8 days.
Has the speed at which President Trump has moved with these executive orders surprised you?
It did. And, we talk all the time about HIV treatment and prevention and the need to go with speed and scale. The speed and scale of this new U.S. presidential administration's executive orders and actions to back those orders up is absolutely gobsmacking in a negative way. We all knew that the new administration was going to work to a very conservative agenda that had been published called Project 2025, but no one thought in 8 days that truly the government, not just PEPFAR, not just the AIDS response, but that the U.S. government truly would be really in crisis and shut down in just 8 days.
What's the atmosphere like in Washington, D.C. right now? Are people scared or are some people celebrating the Trump administration's decisions?
Certainly in the bubbles I am in, there is fear, there's panic, there's disbelief. For me, one of the most striking elements is that while we knew there were disagreements and policy debates, the inhumanity, and not just again about HIV and AIDS and PEPFAR, but the inhumanity about people's lives, people's careers, the absolute uncaring way in which these things are being done, that is everywhere. And I don't think it's just in Washington, D.C., sadly.
Now, a waiver was announced on Tuesday by Secretary of State Marco Rubio for some organizations, such as those providing life-saving medicines. But what does the Trump administration consider as life-saving medicines? Does it include HIV medication?
Well, there are two things, Mia, that I think for me have been defining these last 8 days. One is that things are constantly changing. Literally every hour, every day, there's something new. It is truly crisis whack-a-mole. It is just popping up its head everywhere. So things are constantly changing. The other thing that have defined the last 8 days is the uncertainty. There is so much uncertainty, so much lack of clarity in what the details are. Pretty much every program under PEPFAR was given a suspension or a stop work order. And that was on Monday. And then Tuesday, the Secretary of State, Marco Rubio, who I have to say was once a co-sponsor of the legislation to authorize PEPFAR, did issue this waiver, but it doesn't get into specifics and everything is up to interpretation. We believe now 12 hours later that that waiver of life-saving medication presumably include HIV meds for treatment. We don't think that necessarily the Secretary of State would include PrEP, which is also life-saving, but there's no definition of this. So right now, we are still waiting for how now USAID might unstop things. But one of the challenges is that between the weekend and Monday's suspensions, many programs not only closed their doors, but began the process of laying off staff. So it is easy to break something down. Building it back up later, it's uncertain.
So the big question now for organizations like AVAC that receive PEPFAR funding is what's going to happen next. Many projects here in South Africa also ask those questions. They've been asked to close down. Now there's the waiver, but they've also been told that they will be re-evaluated to see if they're worth funding at all. So what should they do now? Just wait?
We knew that there would be reevaluation of foreign assistance programs. And you and I talked in November, the assumption that PEPFAR would begin to be reduced every year. We knew that was very likely to happen. And we knew also, even if Trump hadn't won the presidency, that PEPFAR was in a process to look at sustainability and transition. But to do those kinds of things, to bring governments to really take on the investment and pay for people to be on treatment, to get PrEP, to service LGBTQ groups, to create programs for adolescent girls and young women, those things don't happen overnight. So the challenge right now is if you were suspended on Monday and you started laying off staff, you're still waiting to understand if you actually will ever get money again, because everything was shut down. You couldn't even draw down payments from the payment system under USAID. So if you're an organization, a big service provider or a small advocacy organization like AVAC, you have no guarantee right now. We were told we have a USAID PEPFAR program. We were given a suspension. We were told indefinitely, you are not allowed to work and there is no money in your program. Full stop. Now, if the waiver does apply to some programs, someone has to alert those programs. Someone has to open up the financial system and give those organizations certainty. Are they going to open for 30 days, for 60 days, for 90 days? Are staff going to want to come back? Are people who now went to clinics over the last 2 days, who saw signs on doors all over the world that said clinic closed, are they going to come back? Will they know to come back? Will they trust coming back? Good partners don't abandon you with an executive order on day one of an administration. And that's what's going to make the sustainability agenda. And remember, when we spoke a couple of months ago, people think about sustainability as all about money. Who's going to pay for it? It's not just about sustaining the financial flows and the flows of antiretroviral treatment. It's about sustaining the impact of 21 years of partnership. And that has just been undone with literally the stroke of a pen. And it doesn't get undone because of a waiver. And if this administration feels that PEPFAR needs to be reduced considerably or eliminated completely, do it responsibly over a number of years so that we can ensure that people's lives are not at risk here. And they are now.
Mitchell, you're one of very few people who work for a PEPFAR-funded organization and who is prepared to publicly speak out against the Trump administration during this time. Why are you doing it if it increases your chances of losing your funding?
Because 30 years ago, this organization was founded to be a voice of science, a voice of evidence, and a voice of human rights. Frankly, if being for evidence and science and human rights means you don't get funded, I'd rather not be funded. And I realize that is a high-risk strategy, but this work is too important. And I hope that in speaking out, that we will find ways to both restart life-saving treatment and prevention. And it's not just treatment and prevention. We've got to find emergency response from other donors to step in, to work with governments to begin to fill the gaps. And we have to work on multiple levels right now. A lot of the conversations these last 8 days all over the world have been, how do we manage this in the short term? And we need to have those conversations because people's lives depend on them. But whole societies and cultures and communities depend on us building a resilient health system. PEPFAR is not just about HIV. PEPFAR has really been the driver in so many countries about building economic stability, about building democratic societies. While we've been through 8 days of what is unprecedented, we have 1,451 more days of this administration. And we can't just be thinking about the crisis today.
What will happen to AVAC if PEPFAR pulls your funding?
We created 9 years ago a project funded by USAID called the Coalition to Accelerate and Support Prevention Research, CASPR. Not everybody loves the name, but what it is an incredibly robust partnership of 13 civil society organizations all over East and Southern Africa with a few global partners. And it has huge impact for ABAC. It represents 40% of our organization, but more importantly, more than half of what comes to AVAC goes out to our partners all over East and Southern Africa, South Africa, Zimbabwe, Zambia, Kenya, Uganda, places that have been the driver of prevention research. So we are, yes, concerned at AVAC. We will be a much smaller organization beginning yesterday. But this is about global health and development. This is about democracy. This is about the way we think the world should be. We know how destabilizing infectious diseases can be. We know how HIV destabilized for 5 years, how COVID destabilized our world order. We know what happens if there's a Marburg outbreak or an Mpox outbreak. So this is not about PEPFAR and HIV. This is about a much larger set of issues about safety, about health, about security, about diplomacy.
Have the organizations that AVAC supports in Eastern and Southern Africa closed their doors?
They are beginning to do massive layoffs, and this is true in service delivery programs as well as advocacy groups, trying to scramble to look for other resources. I don't know that anyone has shut their doors completely and put the Weir out of business, but certainly trying to figure out what is mission critical, what can be done. And there are dozens and dozens of calls every day of organizing. How do we show the impact? How do we find the right people to make the case? Again, remember when he was Senator Rubio, before he was Secretary of State Rubio, he co-sponsored the legislation to authorize PEPFAR. And I hope that waiver is not just a brief pause of a draconian and misinformed executive order, and is actually the beginning of a recognition of what PEPFAR needs to look like in the future and what good partnerships need to look like in the future.
But so far, Marco Rubio hasn't acted like a man who values PEPFAR to the extent that you've mentioned.
Doesn't appear so. And again, we are only 8 days into this administration, and I think we now know that decisions are not made out of evidence and logic and commitments. There's a political calculus happening. We all knew that was going to happen. We do need to look to other political leaders, members of the House and Senate. Remember, Congress has the power to authorize expenditures. They take the president's budget and then they vote and decide. So we need to see members of the House and Senate step up and play their roles. They are not there to do what the president says in his executive orders. They are there as an equal arm of the government in this country. And we need to make sure that they perform their roles of leadership and commitment. The Senate, for 21 years, have come together to support PEPFAR in an unprecedented way. And we have not yet heard from enough of those leaders.
I'd imagine there's a lot of lobbying happening among Congress members by people like yourself right now.
There's a lot of conversations. There's a lot of effort to get public awareness about this, but there's also a lot of things happening behind the scenes, trying to understand what are the power dynamics, who can influence whom to change these decisions. And again, part of that is looking for the short-term, immediate, we're in crisis, what do we do? But there also has to be a slightly longer arc. Well, what are we doing over the next 6 months or a year? And we're going to have to figure that out.
I'd like to talk a bit about South African and African organizations. Can you break down what will happen to the health of HIV patients who now can't get their treatment because clinics have closed down?
Well, it's going to vary by country, and South Africa is different than many other countries in the region in that it already was carrying the lion's share of investment. PEPFAR was a huge partner to the South African government, but South Africa has been the driver. But it's going to put a strain. South Africa, you don't just replace hundreds of millions and billions of dollars of investments in a country or a region by turning to the Minister of Finance to say, oh, PEPFAR withdrew yesterday, can you fill our coffer? It doesn't work that way. And that's why these transitions need to take time and do it responsibly and strategically. But there are countries that are so heavily reliant that the repercussions will happen sooner. A lot depends on what happens in the next couple of months in terms of drug supply and ability for governments to ensure that those people living with HIV who are virally suppressed, and millions of people are, can get access to their antiretroviral medicines. Now, many of the clinics, as they were beginning to shut down under this suspension, were trying to get people multi-month supplies. So it's not as if people are not virally suppressed today because of a ridiculous stop order 2 days ago. But over the next 30, 60, 90 days, if people can't access new supplies of drugs, or if people who might have got a 2 or 3 month supply, say in November, December, before the festive season, if they try to go back to the clinic this week for a resupply, they won't necessarily get it in some countries. We'll see the effects in months, and certainly by mid-year and by the end of the year, if we don't get things restarted. Now, they've said they are simply pausing to reevaluate, but we have no idea what that even means.
I believe the deadline for re-evaluation is 10 February, and that organizations will in effect be evaluated to see if they match up with Trump's ideologies, rather than measuring how effective they are.
Well, that's one of the great challenges. Every program in the world, in every government, and every nonprofit agency should constantly be reevaluated. Are you still delivering impact? But we should know upon what we're being evaluated. That's the problem. We need to know what the metric is. If the metric is a loyalty test to the new president, I can say that many programs are going to be evaluated quite negatively. If we're being evaluated, are we delivering on the mission that we were funded to deliver? That I think pretty much every one of these programs, they need to be tweaked, they need to be shifted, and certainly some programs do need to be redirected in new ways. But we need to know, it's almost like we're giving people an exam, but we're not telling them how we're going to grade the exam. And then the professor just says, oh, I don't like you, so you get an F in your grade. But I like you, you get an A.
Mitchell, have you heard anything about South Africa's in-country annual PEPFAR meeting where partners map out their country operational plan? I think it was supposed to happen in May.
Right now, I don't think there is anyone thinking that there'll be meetings in May. But, we have learned in 8 days to not assume anything. I think it's safe to say that we don't expect those country operating plan meetings to happen, but I also didn't expect that PEPFAR would be ground to a halt in 8 days. Even if everything were to be restarted, what is the future? What does a plan look like? And how do you sit with a country now? How does PEPFAR sit with ministries of health? How do we sit with civil society and say, oh, you know what? Sorry about those last 90 days. Sorry that we closed everything down. So let's just say things get restarted. We all meet in May for the COPs. Are the ministries of health sitting across from PEPFAR going to trust that they're there for the long haul? Not after 90 days of being stomped. So I don't know what will happen, but I am deeply, deeply concerned.
Is the reauthorization process for PEPFAR still coming up in March?
It is, and that's a big question mark. So we know that, for 20 years, PEPFAR had been reauthorized every 5 years from the original language that created PEPFAR under President George W. Bush and supported by almost every member of Congress 20 years ago. Last year, it became a political football, for lack of a better analogy, and that 5-year reauthorization for the first time was not granted, and a single year was provided. And so this March, so in just 2 months, at the end of March, PEPFAR's authorization ends. And so we had hoped that there would be a 5-year reauthorization from March 2025 going forward. That would be importantly timed because remember, in 2030, we have these huge UN targets about ending AIDS as a public health threat. So that's the 5-year window we should be looking forward to. We expected and hoped that this administration would be responsible, but I don't know what's going to happen with reauthorization. I think everything is so up in the air.
Mitchell, so far we've spoken about existing projects that already have funding, but the funds have now been frozen, and some of those projects might qualify for waivers. But what about upcoming projects, such as PEPFAR's announcement in late December that it will help to get the 6-monthly anti-HIV jab lenacapavir to 2 million people in lower and middle-income countries? Can that decision now be overruled by the new Trump person who will head up PEPFAR?
Yeah, that's a great question. And I think that's one of the things, to put it in context for people, that the decisions of the last 8 days are particularly cruel because this has been one of the greatest moments of opportunity in the HIV response. In many countries, we are seeing more and more people get on treatment, virally suppressed, all of the targets there and around treatment. But we were struggling with prevention. And along comes our first cabotegravir, the every 2-month injectable, which is just beginning to roll out, including in South Africa. And now lenacapavir, this every 6-month injectable. We have never had a greater opportunity in prevention than we have right now. And so there was a great deal of enthusiasm in December when PEPFAR and the Global Fund made this big announcement of accelerating access to lenacapavir. The good news is, remember, this was not a PEPFAR announcement. This was a PEPFAR and Global Fund announcement. And so Global Fund is moving ahead. Other funders are supporting and thinking about lenacapavir. Now, as it happens, lenacapavir only got submitted to the U.S. Food and Drug Administration in December. So it's not yet even approved. So we still have 6 months to wait. So we all need to be working the Global Fund, and we cannot let this government in the United States derail everything.
So you're saying if PEPFAR pulls the plug on the lenacapavir deal, there will still be other donors. And you've mentioned the Global Fund, but the Global Fund's largest donor is the US government, isn't it?
It is. And this is this domino effect. I mean, it could all crumble. And, the replenishment takes place over the course of this year. There's obviously a huge display of inhumanity in the executive orders of the last 8 days. And I don't think that's going to change back overnight. But they're clearly flexing their muscles. They're showing off. They're saying we're in charge. And we've got to make sure that in addition to battling the crisis, we have to look at these other sets of issues. What will happen to the Global Fund if the U.S. doesn't contribute? It would be a disaster. But Global Fund relies on many other donors. How are other donors going to respond? We've heard very little from other countries.
So what happens if the Trump administration says PEPFAR can stay? It can be part of the lenacapavir deal, but a donor like the Global Fund, because they get US government money, has to adhere to the gag rule. So they expand the gag rule, and then the Global Fund is restricted as to who they can fund.
It's going to be huge challenges ahead. And you're right. There are real risks that, they'll say, oh, we'll restart PEPFAR, but you can't work with young women because we wrongly think abortion is part of the program. We don't want you to work with LGBTQ plus groups because they don't exist in our world order. And we don't want the Global Fund to do that either. Already we're seeing issues of anti-transgender ideology dominate this administration. And that's a huge risk. It's going to take leadership. And again, I talked about the U.S. Congress and leadership needed there. It's going to take leadership from other countries. It's going to take leadership from industry. It's going to take leadership from civil society. I don't entirely know how we're going to do this. We have to live with a bit of uncertainty or a lot of uncertainty, but not be paralyzed. In some ways, perhaps there's someone in the administration who actually just wants us to be paralyzed, who, wants us to just all close up and go home and forget this. We have to make sure that paralysis is not our response. Panic a little bit, but strategize.
Mitchell Warren, thanks for sharing your time and your insights. We really do appreciate it. Mitchell is the Executive Director of the New York-based advocacy organization AVAC, and he was talking to me about the latest developments in the Trump administration and the potentially devastating impact of the new US president's decisions on South Africa's HIV programs. I'm Mia Malan. Until our next podcast episode, stay well.
This was a PEPA podcast.